Everyone, today we'll talk about heart failure. So, what heart failure means is whenever the pump of our body, that is our heart, is unable to meet the demands of the tissues. So, whenever the heart cannot supply enough blood to meet oxygen requirement of our tissue, then we call that the heart is failing. So we have this heart with left atria, left ventricle, right atria, right ventricle. And since we know that our heart is basically two pumps connected in series, so the left side of our pump supplies our peripheral tissues. These are all the tissues. This is what we call the systemic circulation, and the right side of the pump sends this deoxygenated blood to our lungs, which oxygenate them and send back the blood to the left atria, and it goes on. So whenever the left side of our heart pump is unable to do its job, we call it left-sided heart failure, and whenever the right side of the pump is unable to do its job, we call it right-sided heart failure, right? So we'll move to the causes of these both individually. So first let's talk about left-sided heart failure. What all can cause this condition is, first of all, we have ischemia. So ischemic damage. The cardiac muscle supplies blood to our whole body. It contracts throughout our life and it needs oxygen to do that. If ischemia is there and cardiac muscle is not getting enough oxygen, then it can lead to damage or death of the cardiac myocytes, and the contractile ability of the heart can decrease, which can lead to heart failure. Then we move to hypertension. Hypertension basically means whenever there is increased peripheral resistance. What this increased peripheral resistance does is, there is increased workload on the heart, which makes these structural changes in the cardiac myocytes, which affects their contractile ability and can lead to heart failure. Then there is dilated cardiomyopathy. How dilated cardiomyopathy causes heart failure is, we know the law of Laplace. The more dilated the heart is, the more problem there will be in generating the same amount of force to eject the blood. So if heart becomes dilated, it will have to generate more force to eject the same amount of blood, which can lead to cardiac failure. Then we have myocardial infarction. Ischemia can cause myocardial infarction if the coronary arteries, let's say, get thrombotic embolism, or the atherosclerotic plaque gets ruptured. Then it can lead to prolonged ischemia of the cardiac myocytes and subsequent necrosis, which can cause myocardial infarction. This myocardial infarction leads to death of cardiac myocytes, so they won't be able to contract and generate enough force to eject blood. Now we have restricted cardiomyopathy. What does this mean is, we have our heart and this is the sac in which it is placed. If it is not able to expand fully, it won't be able to acquire as much blood volume as it does, and it will directly influence the cardiac output. So if heart is not able to expand fully, it will affect its cardiac output and can lead to cardiac failure. Now, talking about the clinical features of left-sided heart failure, let's first understand this. If the left ventricle is not able to pump adequate amount of blood to the circuit, it will lead to back pressure. So more blood will be there in the left atria, leading to back pressure, more blood in the pulmonary circuit, and which can lead to congestion of the pulmonary vessels. So it can lead to pulmonary congestion and edema, and because of this the clinical features will be that of dyspnea, difficulty breathing, paroxysmal nocturnal dyspnea, because when you lie down, because of gravity there is increased venous return, and it can lead to dyspnea because of increased congestion of the lungs. Orthopnea, same principle. Crackles, because there is fluid in the alveolar sacs. These all clinical findings are because of pulmonary congestion. All right. Then there is this very interesting term called heart failure cells. Now, since we know there is pulmonary edema, the pulmonary capillaries which were first like this become dilated and can even rupture. These ruptured capillaries will lead to accumulation of some blood in the alveoli. This blood gets taken up by alveolar macrophages. Now, since these macrophages are eating this blood, ingesting this blood, they are basically ingesting iron, which will lead to these hemosiderin laden macrophages. These are called heart failure cells. Here all these brown colored cells that you are seeing are all heart failure cells. Now, this heart failure is leading to hypoperfusion of all the tissues, which includes our kidneys, right? So our kidneys are not getting enough blood, which will lead to activation of renin-angiotensin-aldosterone system, which will lead to fluid retention. Now there is more fluid in the circuit, which will make it harder for the heart to pump and will exacerbate the features or findings we see in the congestive heart failure, right? Talking about treatment of heart failure, we have different guidelines for AHA class A, B, C and D. A, B, C all contain compensated heart failure, and D is for decompensated. For compensated heart failures, what we do is we give cardioprotective agents so that there is no further deterioration of the heart, right? These include ACE inhibitors or your beta blockers and other cardioprotective agents. Whereas in case of type D, that is the decompensated heart failure, we give inotropic drugs so that the perfusion to the brain and vital tissues is maintained until we can get a new heart for the transplant. Alright, that finishes our left left-sided heart failure. Moving on to right-sided heart failure. So the most common etiology for right-sided heart failure is left-sided heart failure. We talked about how the heart is two pumps connected in series. So our special pump, when the left side isn't working so well, it will lead to back pressure in the pulmonary circuit, which will ultimately lead to back pressure here, and the right side of the heart will need to work against increased resistance, and which can lead to right-sided heart failure as well. So most common cause of right-sided heart failure is left-sided heart failure, which is very important. Now, other causes of right-sided heart failure include left to right shunt. Now, what does this mean is, whenever there is this channel which can cause blood from the left-sided circuit to flow to the right side, it is called left to right shunt. Now, let's say there is some ventricular septal defect which is causing blood to flow from left ventricle to the right ventricle. It will lead to increased blood volume in the right-sided circuit, which can lead to heart failure. So this is particularly important. Then there is chronic lung disease. Now, This is special because it has to do with some special properties of capillaries in the lungs. In our peripheral tissue, whenever there is hypoxia, the capillary caliber increases to supply more oxygen. But in case of lungs, if the part the capillary is supplying is having less oxygen, it leads to further constriction of the vessel, so that more blood can be diverted to more perfused areas, so as to maintain perfusion, so as to maintain ventilation perfusion ratio, to maintain ventilation perfusion. If there is hypoxia, it will lead to further constriction of these vessels, which will lead to increased resistance in this circuit, which can ultimately lead to right-sided heart failure. Coming to clinical findings in right-sided heart failure, we have jugular venous distension. These are all because of the right side of the heart is not able to pump adequately. It is leading to back pressure, and the veins which are pouring in the right atrium will get distended because of this back pressure. So jugular venous distension. Hepatosplenomegaly, because ultimately all these veins are draining into the right atria. The back pressure is causing the liver, the spleen, all these to enlarge. There is this characteristic finding of nutmeg liver. The photo you can see here. You can see there are a lot of these tiny distended, congested capillaries here because of the back pressure. So this is what we call nutmeg liver. Then we have dependent pitting edema. So again, the whole of the venous drainage from the body is coming into the right atrium. The back pressure is causing the blood to stay at the peripheries. Because of gravity, the blood will pool in the dependent parts of the body. It will cause pitting edema. So thank you very much. That's all.